pharmacies really have two choices for this new type of model. They can either add more pharmacies, add more pharmacists, or they can put in solutions that empower patient-facing care. Thus, they need to remove or redeploy the pharmacist from the back of the pharmacy to the front of the pharmacy. And it really boils down into two areas. They can have centralized services, or they can have retail deployed solutions. And when I say centralized services, there's really a lot of areas that can be centralized. You can centralize the pharmacist verification 1. You can now centralize the pharmacist verification 2. And that could be a process where we digitize the technician processing the prescription, and then that verification can either be moved out to a workstation out front for the pharmacist to verify locally, or it can be centralized in a main processing center, or workload balanced across a variety of pharmacies, taking advantage of underutilized pharmacists. And then that allows that pharmacist to always be the first point of care for the patient, and then the last point of care. Having impact on compliance, having impact on disease state management, those areas where they provide additional benefits to the 5-star rating for the medical providers. In retail-based solutions, technology is broad, but the biggest impact we see are in digitizing processes, as I mentioned, or having solutions that have very high availability. Traditionally, there's some challenges in robotics deployed at retail, where with the high turnovers that you see at chains, there's not a great utilization of that technology. You may have gotten a good price on it, but you may only get 70% use of it because of the continually retraining, retweaking, all the technical resources that's required. So we've deployed new disruptive technology that addresses that at retail, where you get a much higher utilization. You may get 20, 30, 40% more than what we traditionally have seen utilized, and all of that helps this pharmacist redeploy. Well, traditionally, centralized services have referred directly to central fill. So you take the refills of the prescription, put them in a factory or production-like setting where you get a very high efficiency, high utilization of automation, and you really drive labor costs out of the prescriptions. Now we've seen tremendous growth in that for us as a company. In the last 8 years, our revenue has tripled, really. And specifically in that area is where the majority of our revenues is derived, is in centralized processing, central fills. So we have multiples that we've just opened. We have multiples that we're building before the end of the year, multiples that we're engaged in for next year for builds for chains. So it's still a very high growth area for us. And the biggest impact is just the pure labor cost per script. You're able to get that pure labor cost below 50 cents per prescription, which in comparison to the store, provides an ROI on a central fill that can be in the terms of 18 to 24 months to 36 months to have that technology paid for, and then you continue to leverage it for an additional 7, 8, 9 years. So very efficient way. That's a great question. We have a broad toolbox really that we employ for situations like that. The bottom line is what we challenge our customers to do is to look at a local pharmacy as a production center versus a pharmacy. And a lot of them need help in that area to really transition their thoughts into more of an assembly line type process. We worked exclusively with the Watson Institute at SUNY New York, Binghamton to provide services like this. We have a professional services division that gets engaged, does analysis and then simulations to predict workflow, but most importantly to create an efficient workflow model. But as you ask, which solutions specifically, the digitization of processing, which basically means that we're going to have a tech now do what a pharmacist may have done in the past, but we're going to document those steps digitally by taking pictures of them. And then those pictures are available for the pharmacist to verify at their front-facing processing station. If we all kind of look back and say, where do we envision the pharmacist when we go to a pharmacy? We always see them trapped back behind the counter. We see a phone to their ear. We see them trying to count tablets or look in vials. We don't see them engaged with the patient. And the models that I've seen becoming very effective today are the ones where the patient interaction, whether they ask or not, every single script at presentation to the patient is done through the pharmacist. It allows them to ask questions that the tech doesn't know to ask. It allows them to differentiate their care between somebody who has a tech that presents the script to the patient. And most importantly, as you referenced this 5-star plan, is providers are looking for pharmacy partners that can help them improve in those areas, because that's the partnership with somebody who can help improve compliance and disease state management that will help them maintain their 5-star rating. As I mentioned, professional services was really an area that we've grown quite rapidly over the last few years. There's lots of consulting companies that are out there, but what we find is they're not versed or experienced specifically in pharmacy. So they approach it agnostically, looking at it, for example, as a production line that produces tires for cars. And the difference is those are all those are all same items. In a pharmacy, we're talking about every single item is unique and different. It's specific to the patient. Because of that, it presents a challenge for traditional workflow methods. So this professional services division has been engaged by many chains, many hospitals to provide this services. This fall, we're also going to host a fall summit in conjunction with the Watson Institute at SUNY New York, and invite industry leaders to come and participate in a 2-day summit and really understand production level systems, and those apply both to retail and to high volume central fills.